Good balance is important as we get older. It prevents injuries and the risk of falls, which can be life-changing as you approach retirement age. Fortunately, improving your balance and stability is really, really easy, and we're going to be covering one simple exercise that you can do in today's tutorial. If you're new here, welcome. I'm Michael Fatika, the lead osteopath and spine specialist at Back in Shape, and we help people around the UK and all over the world fix their back pain and get back in shape for the long term. And in this tutorial, we'll be covering the step-up exercise, a great one you can do at home, and we'll also cover some strategies for making it easier and harder depending on your specific ability. So let's get into it. So for this exercise, the best place to go is the bottom of the stairs. I've obviously got the weights here and I've got the bench here. You're going to want to use the bottom step of the staircase and have the wall or the post of the banister for some support, especially the first time you're doing this, just to make sure you feel confident enough that you're not going to fall over. Remember, we're improving your balance here, so we want to make sure we're stable. The first step is to put your front leg onto the step like so. And in this position, we want to start to have most of our body weight coming through this front leg. We want our knee and our toe in alignment. The next step is to chest pop out, so engage our upper back muscles to support good posture and tighten the core muscles here. That keeps your torso nice and stiff, so we're going to be hinging at the hips, keeping our spine stable. We don't want our spine moving all over the place. Next, we're going to lean forward slightly, so we're putting most of our weight now on this front leg, engaging the muscles and sticking our bum backwards ever so slightly, so you can feel the glutes or the buttock muscles starting to activate, and you can feel that there's a bit of tension on your leg. And now, with a little bit of support if necessary, we're simply going to press our foot into the step and come up into the standing position. Once we're here, we don't rest, we pause for a moment, tap our foot on the step, and then with these muscles still engaged, we push our hips backwards again to lower down nice and slow, all the way to the ground, and that's one repetition. And then we simply repeat this here up, and then slowly lowering back down, and then up, and slowly lowering back down. I'll show you again from the side, but when we're doing this, try and take around about 2 seconds or so to lower yourself down, focusing on really controlled movement with that front leg and good balance. So from the side, what that's going to look like, obviously you wouldn't be leaning forwards, I'd be supporting myself on the side here. We pop the one leg up, we engage our upper body, engage our core, engage our spine. We lean ever so slightly so we've engaged the front foot that we're working on. We've got our bum sticking out ever so slightly so that we've got the glute muscles engaged and our thighs nice and strong, and then simply push up to the standing position, and then we lower straight back down nice and slowly and repeat 4 repetitions here. Ideally, when you're doing this, you're going to start with the number of repetitions that you can do well. We'll get into some of the mistakes in a moment, but it might be that you're doing 3 or 4 or 5 reps well on one leg and then you switch to the other leg, and you'll probably notice that one leg is a little bit stronger than the other. And don't worry about that to start with. Just do the right amount of reps on each leg so that you're not losing form and doing things badly. That results in injuries, and we don't want that. Ideally, you're going to aim for 10 reps on each leg and doing something like 3, 4, or 5 sets each time you do this exercise. Now, I would suggest you only do it once a day. If you're doing fewer reps, maybe you're only getting 3 or 4 good reps. To start with, you could do it a couple of times a day, having adequate rest, maybe morning, middle of the day, later on in the day, just for the practice purposes. But later on, we're going to only want to do it once a day, but work hard, and we'll get onto that towards the end of the video. Next, we're going to cover some common mistakes that people make when they do this, so make sure you're not making these. Otherwise, you're either going to make it easier or you're going to increase the risk of injury, and we don't want any of that. So the very first one is that people are moving too fast. So we're here, we're up, we're back down, we're up, we're back down, and we're just not doing the exercise with control. Doing that is easy, you don't feel any engagement of the muscles, and you kid yourself into thinking you're actually better than you are. The slow control as we lower down and as we come back up again really helps us get that mind-muscle connection into the area that we're working on, and we're doing it with more purpose. So don't do them too fast. The next mistake that people commonly make is going to be rounding the lower back or moving the lower back as we're doing this movement. We want to keep a nice strong core and a nice strong back. That helps us avoid putting unnecessary strain on the lower back when we're maybe going up the stairs, carrying the laundry or carrying something to take up or down the stairs. We want to have a strong spine so we're not increasing the risk of back problems. So going like this as we're coming up and wobbling the spine all over the place is going to be a real error. The next one is a really common mistake, especially as we get a little bit older. We tend to find that members of the program and patients that we see here in the clinic tend to have weakness in the knees, and they try and do less and less because their knees are problematic. And we forget that activities like going up the stairs or going up a step when you're out and about can be real factors in making your knees worse and worse because you don't have the strength there and you're allowing the knees to wobble. So movements like this, as you go up into the standing position and allowing your knees to wobble, are movements that you must avoid. You need to keep your knees over your toes pointing in the same direction. We also shouldn't have any pointing out or in of the toes. Align everything correctly before you begin so that you can practice a skill that's going to transfer to everything you're doing on a daily basis, making daily life safer. The next tip is a little bit finer. The mistake people make is sometimes when they're going up into the step-up position, they're going up on the toes or they're pressing through the heels. Make sure you allow your foot, imagine it fusing and sinking into the actual step that you're using so you have a nice strong base of support. Don't use thick trainers or cushion trainers. If you're doing this at home in the house, do it with your bare feet to start with. Splay your toes out as you're placing your foot on the step that you're using and really connect with the ground through the entire foot and then provide that pressure evenly through the foot as you come up into the step-up position. And the final one is using too much momentum when we're doing this exercise. Bouncing up off the bottom leg, pushing up like so, and again, very similar to moving too quickly, we're using our body weight to help us do the movement, which is a classic sign when we see this when people get out of a chair badly, is that it's a classic sign of weakness in the leg muscles, that we're kind of trying to throw ourselves into these movements. And think about it, that's not a very good way to be in daily life because we're using momentum to compensate for a lack of strength. And that momentum perhaps can't be controlled very well, and that can give rise to injuries, falls, knocks, etc. The important thing here is that you focus on avoiding those mistakes we've discussed and following the instructions earlier on in this video to do this exercise correctly. Whether you're going to do one of the easier variations that we're going to discuss now or one of the harder ones, always be mindful that as you up the intensity or you try a more challenging variation, these mistakes can always creep back in. So you must be vigilant. Whether you're doing them with a smaller step, like we're going to discuss now, or you're doing them with 10 or 15 kilos or pounds in your hands, always watch out for those common mistakes because they will creep back in. One of the important strategies that we need to have for you guys is to make the exercise easier. Some of you will struggle to do that. You might even be considering getting a stair lift put in the house to allow you to get up the stairs because it's bothering your knees and your back so much now. So start where you start. And that could even mean something as small as half a step size. Get something in the house that represents something like this that you can begin with. A smaller step requires slightly less strength in the legs and it requires less of a bend in the knees. And it might be that you start here, or maybe you don't have a smaller step, in which case use a little bit more of your arm support as you're going up and really help take some of that body weight off so you can focus on doing the exercise without pain. Ultimately, when we're doing these exercises, we shouldn't be experiencing any knee pain, ankle pain, back pain, etc. If you are, there's a very good chance you're either doing too challenging a variation or your technique is going wrong. For example, if my leg muscles are too weak and I'm making the classic mistake of the knee rocking over as I'm doing my step up, I'm going to get knee trouble. Now, I can do one of two things. One, I can first focus on trying to keep the knee steady, and at the same time, I can potentially use a lower step like I'm doing and or some support from my hands on a chair or a countertop, depending on where I'm doing this in the house, to make sure that I can really focus on that little bit of bend. And then once we've mastered a lower step, we can then go back up to the normal size step that we've been doing earlier and progress on from there. The important thing the whole time you're doing this is that you're doing it in no more than a 1 or 2 out of 10 pain, with 10 being the most pain and 0 being no pain. Sometimes you are going to get a little bit of discomfort, and you certainly should, if you're working correctly, feel some of your thigh muscles getting tense and tight, the glute muscles and your core and back muscles as well, as they're being used to stabilize the movement so that our joints don't get damaged. So a little bit of discomfort in those muscles is okay. We shouldn't be getting knee pain, back pain, hip pain, ankle pain, etc. And again, do the number of repetitions that you can do without pain correctly with good form, and then build up to aim for that 10 repetitions on each leg for 3, 4, or 5 sets. So the next exciting step is making these exercises more challenging. Ultimately, we need to be progressing what we're doing. So once you can do 5 sets of 10 of your chosen variation, you need to be thinking about what's the next way you can make this a little bit more difficult. And there's a couple of strategies that we can do here. Firstly, we can make the step higher. If we're just using the bottom step of the staircase, like I've been doing earlier, around about that sort of height, that's not really enough. We want to progress ideally onto something that is moving towards our thigh bone being almost parallel, if not parallel to the floor, so horizontal. And that will allow us to really build some strength. But to do that, we're going to have a good amount of base strength in our leg muscles. So we're going to have to build up to that slowly. When you're using higher steps such as that, work on the lowering phase being around about 2 to 3 seconds. This is difficult. You're going to require a lot of proprioception, balance, and stability going through your feet, through your leg muscles, through your core, and through your back, concentrating on what you're doing. Doing so will make significant improvements in both your strength, balance, and stability for the long term. The second thing we can do to make this even more challenging is start to use weights. And you'll see some of these examples on the screen right now. But the first option is that we can use something like a resistance band, if you've got those lying around the house, to go through and make the exercise more challenging, working the muscles of your thighs a little bit better as you move up into that step-up position, and also challenging you on the way down. The nice thing about the resistance band is that it is a bit variable. So it means that as you get to the last bit of the step-up, the easiest part coming up, it's a little bit harder on the resistance. And as you lower yourself back down to the lower part or the bottom position, the band is a little bit less intense. So it's going to give you that variability, making it an easier transition than using weights. The next step is to use weights, using a kettlebell or a dumbbell, because simply put, that box of laundry or the shopping or the little one that you're carrying up the stairs doesn't change in weight as you go through the step. So using weights can be a great next step. Just holding them with your arms nice and relaxed, keeping these super relaxed as you're doing the whole exercise, because the temptation when you're using the kettlebell or a dumbbell in one hand is that you can swing it forwards to add a bit of momentum. Remember what we discussed about the mistakes earlier. Don't cheat when you're doing these. You will thank yourself for it. For some of you, holding a weight might not be ideal, and with time, you might find that actually you need more than just the weight that you've got. And that's where things like weighted vests can come in for those of you doing this at home. They give you the ability to add 1 kilo at a time, up to 20 or 30 kilos, to have something just over your chest so that when you're doing the exercise, you've got that extra bit of weight that you don't have to carry in your hands. This can be also replaced by using a rucksack with some items in there if you don't have the weights equipment. But just be mindful that if you are carrying a rucksack, yes, it's true to life. You might be on a hike or something like that, or walking around town, so you've got that extra weight. But it will play around with your center of mass, so you'll need to compensate for that slightly. Make sure when you're doing that, you're doing it in a way that keeps your core nice and strong and your back muscles nice and strong, so you don't violate some of those mistakes we mentioned earlier with regards to rounding the back or moving the spine in one way or other. This simple exercise can really help you make improvements in your balance and stability. In the clinic and with members over the years, we've seen the real consequences a lack of strength and stability in the lower body can have when we run into trouble, particularly obviously with back injuries here at the clinic and on the membership. People with a bad back really struggle when their legs don't do the work and when they don't have balance, because they throw themselves off time and time again. And this isn't just people in their 50s and 60s and older. It often happens in those that are younger. We just haven't built the proper foundations of good stability in our lower body, so that we're carrying along, getting away with bad habits, improper skill levels for a long period of time before we actually get into those older years and approach retirement. It makes sense because nowadays, even in our 20s, we spend so much of our time sat down, not using our body, not exercising. And even if we were particularly active when we were younger, as we get into the workplace and start doing all these things on a daily basis, we lose the motivation and the familiarity with using our body properly. So even if you are under the age of 40 or in your 40s right now, starting, at least evaluating, using this as a test to see if you can do these things appropriately will be a great eye-opener for many of you to say, actually, maybe I can start working on this before I have an injury, because it will be so much better for you when bad luck does strike and you do have an injury of some description in your knee, your hip, your ankle, or your lower back. Ultimately, you need to make a commitment to improving your strength and stability. And this is a great way to start doing that, whether you're going to use the step at the bottom of your staircase or whether you want to use a sturdy dining table chair. Start with this exercise and build from there. Make sure that when you look back in a month's time, you're doing more than you are today. It really will pay dividends. And over the course of months and years, the changes are really transformational. And you'll find yourself, compared to your peers, being way different in terms of the ability and the independence we have. And as we do approach our retirement, a time when we potentially have significantly more free time to do the things that we actually want to do on a daily basis, be it playing with grandkids, be it going out on excursions or traveling, etc., we don't have significant limits on our mobility because we've put the work in now. But remember, the best time to start is today. So don't regret the fact that you're not where you want to be right now. Make the commitment to make a start now and move forwards from here. Hopefully you did find this video helpful. If you know someone else who's struggling with their stability, or you've seen them get a few injuries or have a few wobbles when you've been out with them, then consider sharing this video with them. Get started doing the simplest or the hardest variation that they can do of the exercises we've discussed today, and hopefully they can make some significant improvement over the weeks and months to come and really change their life too. As always, there's that comment section down there, so if there was anything that was unclear, please do share your thoughts, share your comments. We read and reply to all of those, and we'll see you in the next video. Thanks for watching.